This is Sarah Hughes. I'd like to introduce Sarah, who's the Chief Executive of Centre of Mental Health. She tells me she's very good at speaking very quickly. But she's going to talk to you about health inequalities, mental health and CVD, breaking the cycle.
So I do speak very quickly. I'm a Londoner, so I might sound a bit like Cat Slater from EastEnders, so I apologise in advance. But I'm going to speak very quickly because I have to. I've been told that I need to. So I'm going to be talking about mental health and cardiovascular disease and inequality. And I hope that by the end of it, I won't be chased out the room, but we'll see. So, okay, this is what I think parity of esteem looks like. So we have conversations all the time, don't we, about parity of esteem. And we talk about the inequality between physical and mental health. But the reality is, for many people, we still are in a situation where physical and mental health are never brought together. The government never know what they're going to invest in. Now, this is not a Friday night in my house, very close to it, but it isn't. This is the face of inequality. So people with mental illness often live in poverty, they live in poor housing. People with cardiovascular disease are 3 times more likely to have mental illness. And this is the experience of living with mental distress and cardiovascular disease. My dad had his heart attack at 39, and he talked about himself living like a bleeding volcano, always worried and anxious that something terrible was going to happen. I'm sorry to lower the tone, but I'm a bit like the Grim Reaper. Do you know that people with mental illness often die up to 20 years before everybody else does? This is a global scandal. And I think we're talking about something that's incredibly serious. The mortality rate in various parts of the country is decreasing, not increasing. And that's why we at the Centre for Mental Health developed the Commission for Equality in Mental Health. And the reason why is because we were absolutely concerned that we're really not getting beneath the skin of inequality in the UK. We've got 500,000 children living in poverty right now. That's not doing any good for anybody's heart health. Does anybody recognise this building? It's Free and Barnet. It's a psychiatric hospital in London. And I spent quite a lot of my childhood roaming around the grounds because I had a family member who was a patient. And I remember seeing people with very serious physical health needs roaming around, not being attended to. And it's still the case today. We call it in mental health the kind of mannequin effect, where doctors and nurses and people in mental health services do not see the whole person. People describe themselves as almost being separated, their mind and body. And it's absolutely kind of illustrated by the GP that will only see you for one thing for 10 minutes. Now, this is a thing. Why do we think this is? I hate to say it, but we still have a bit of a culture of doctor knows best. But we do. How good are we at really listening to patients' stories about their mental distress? We talk about integration. There is an open door. We talk about we're going to see you as a whole person. But people that we talk to, still say that they walk through the open door of integration into a big brick wall. And I guess from our point of view, we see Public Health England and all our colleagues across NHS doing fantastic work, fantastic, massive campaigns, huge investment, but you will notice they're all separate campaigns. What brings these campaigns together? Do you see the thread? And then we have these two dudes. Now, my daughter still believes that one of my relatives is married to Jamie Oliver. That's how much we do love this man. But the reality is, he's quite disconnected. How often do you hear these people talking about inequality and the intersectionality between mental illness and long-term conditions? Our media is out of date. What we really need is a healthcare system that is truly open, that truly understands the nature of inequalities, that truly thinks about the particular needs of the patients that we are dealing with in local areas where there are huge differences, ethnic differences, all sorts of differences. We need an emotionally intelligent workforce. If you've had a heart attack, my dad had a heart attack at 39 and never recovered. The fear and anxiety absolutely blighted his life for the 20 years that he had left. He then died of heart attack. So I'm saying to you, look, Human relationships are what's important. Do you, as healthcare professionals, really understand, look outside of your medical care? Last week it was Time to Change week, Time to Change talk day. Did any of you do anything around that? Raise your hands if you did. A few of you, but not all of you. So what else do we need? We need integration. We need things like shared systems decisions. We need pooling budgets. That's not a unicorn. People do pool budgets in lots of places in the country. That's absolutely possible in relation to the work that you do and the work that I do. People with lived experience at the heart of it. And that is why the Centre for Mental Health brought equally well from Australia to the UK. And you can see all the people that have signed up, the Royal Colleges. And this is really about putting people with lived experience, professionals and organisations together, designing solutions together. We need to be focusing on population health. We need to be thinking about local needs. You need to be understanding what services are available to you locally. If you don't know what mental health services are available in your area, then you need to go and find out. Do you know about the Prevention Concordat for mental health? Anyone here? Few, not all of you, certainly not enough. Go and find out what they're doing. Is CVD in the Prevention Concordat in your area? If not, why not? Make it so. You absolutely have it in your gift. So whose responsibility is it? It's yours.